Welcome to the Prime Health Podcast with your host, Dr. Derek Barron. Dr. Barron interviews doctors, wellness experts, and healthcare leaders who are revolutionizing how we approach health and longevity. The Prime Health Podcast explores breakthrough science, personal and patient stories, and practical insights that are shaping the future of health and wellness. So sit back, listen in, and prepare to transform how you think about your path towards Prime Health with Dr. Barron and his special guest.
Welcome back to the Prime Health Podcast. I'm your host, Dr. Derek Barron. I'm here to bring you cutting-edge insights and practical strategies from leading healthcare experts for your journey to Prime Health and business and in life. So today we've got an amazing guest because there's a lot of noise in regenerative medicine right now. Big promises, big bold claims, and very little accountability. But my guest, Dr. Ramon De La Puerta of Z-lounge Regenerative Medicine, takes a different stance. Clear limits, careful screening, and responsibility for outcomes. This is going to be a conversation about trust and not trends. But before we jump in and talk with Dr. De La Puerta, just a little bit of information from our sponsor, Growth Solutions, your growth partner that turns healthcare expertise into marketing leadership, one strategic move at a time. Growth Solutions eliminate stressors in the business, such as new patient or client acquisitions, marketing and growth strategies. We reduce operational chaos with proven systems, frameworks, and SOPs. And we even help you implement AI and AI agents because the robots are coming whether we like it or not. So if you ever thought this, I'm too busy to grow, too slow to scale, or too overwhelmed to fix it, we are your solution. So just drop the word grow below in the comments or feel free to reach out to me on any of the social platforms that are out there. But you're here for a reason today, and that's to meet our amazing guest. Dr. De La Puerta, welcome to the Prime Health Podcast, and please tell us a little bit about yourself and what you do.
Thank you, Derek. Good morning. Cold day in December, right?
Yeah.
My name's Ramon De La Puerta, Dr. Ramon. I'm the CEO and founder of Z-lounge Regenerative Medicine. I work in stem cell therapies. I've been doing this for about 10 years. Started back in 2015, 2016, roughly. I was studying a master's in Chinese medicine. I'm an MD by training, but I went on to study a master's and then a doctorate in Chinese medicine in San Diego. And I was doing some work in orthopedics, and then a friend of mine with whom I did some aesthetic medicine with called me and asked me what I could do for a patient with an ACL MCL tear. He was a weightlifter and he wasn't able to compete anymore because he had this injury in both of his knees. So he asked me what I could do. So I started doing some research, and I found that if we use electroacupuncture, chiropractors might know it as dry needle. Yeah. So if I use acupuncture with electrical stimulation into the joint in a certain frequency, I would stimulate the physiology of stem cells. So I want to go stem cells. And I went back to when I was in medical school and we learned about stem cells. And unfortunately, medical school doesn't teach you what mesenchymal stem cells are. Most doctors will answer, oh, I know everything about stem cells. But the problem is that what they know about stem cells is what they learned in embryology class. And we didn't learn much. I think we touched stem cells for about two or 3 days back in medical school in the 90s. So imagine the lack of knowledge by most of the doctors who are dealing with these types of patients and with this new technology. So I went on, I saw stem cells and I got excited. We did some work. My friend did some platelet-rich plasma, and I did a four acupuncture needle protocol with e-stimulation. And surprisingly enough, about 3 months after, this guy was lifting weights and competing, and he was so happy. So that was my first stint at regenerative medicine. After that, we started getting a lot of attention by labs. Back then, there was this big American lab, Livelion. They're not around. I think that they had some trouble. But at the same time, a lab in Mexico City called me, and they were training doctors to start doing regenerative medicine in Mexico. So I was one of the first doctors to get trained in Mexico City with this labs, Gen Cells. So when I started looking at what we could do with mesenchymal stem cells, and I actually learned what mesenchymal stem cells were, it changed my whole outlook on medicine. And I went from aesthetic medicine and just wanting to make money to, hey, this is something that I can do, that I can actually help people. It's real science. I'm actually working in my field versus trying to make someone beautiful, which is, it does have its needs. There's people that need to feel well, and it's a total good option to go to. But I went into medicine to help people. So this was a way of me, getting back into the science and helping people and actually see good results with what I was doing. So I know it sounds kind of long, but that's kind of the way that I got into stem cell therapies. And then the rest is history. I found a business partner, and that time it was Dr. Green in R3, and we started R3 International. We made it grow. And then from then, I just moved on, open up my own clinic and my own business, and here's where I'm at.
Yeah, I want to dig in more into your businesses for sure, but I do want to step back a little bit and really ask, as you said, you went from the medical doctor to then starting to study traditional Chinese medicine, I guess. But was there a moment in time when you were younger that you said, you know what, I want to take a leap of faith and jump into medicine? What was that triggering point for yourself?
Well, I was always a kid that liked to read. My dad was very adamant about me reading and me knowing a lot. So I've kept up with my kids. I think knowledge and studying is the most important thing we can do in life, because that's what takes us anywhere. So I was studying, and when I was a kid, and my biggest dream was to be promoted to middle school, because in middle school, that's where you really get the lab experience, and you got to wear that little white coat and go into the lab and I remember my seventh grade, we did a dissection of a rabbit. I know it's gross and everything, but when we opened up and I saw his little heartbeat and all that, and then I tried to sew them up together, and it was just funny. So flash forward in high school, in Mexican high schools, they train you for a professional life. So before going to college, you get what in the U.S. is equivalent of an associate degree.
Okay.
So you get it from high school. So my associate degree in high school was clinical analysis. So we started to work with blood, with microscopes and just doing all the lab processes that everyone does. So I started drawing blood when I was really young. I was probably 16 when I started drawing blood, and we always just beat our vein, because we will do it, with each other, and we were all kids. That kind of made me afraid of needles. That's the whole story. So anyways, I was going through that, and my best friend at the time, he was sure he wanted to be a doctor. So when we were in 12th grade, he said, why don't we apply to medical school? And I'm like, okay. So we applied to medical school, and I aced that test. So we aced that test. We were like 3-4 kids that were really nerds. And we aced that test, and I got into medicine. Funny enough, my friend didn't.
Oh, no.
Well, no. He went to a private school. I went to the University of Baja California in Tijuana.
Okay.
Back then, it was number 4 in the country. Today it's number 1. My son just graduated from it. He graduated with honors, and Ramon Jr., and he's starting his residency in orthopedic surgery next year. So pretty proud of that. But back when I studied, it was number 4 in the country. So my friend didn't get in. So he went to private school. He went to the University of Guadalajara. So
okay.
I was alone and friendless. So I got into medical school, and I just loved it. I see people say that medical school is difficult, but I think that anything is difficult when you don't want to do it, and when you love what you do, it's not difficult. It's just fun and learning became fun and school became easy. So that's how I got into medicine.
Yeah. Well, thanks for sharing that story. I appreciate it. And congratulations to your son. That's got to be a proud father, proud family moment. And hopefully at some point in time, he'll maybe want to come and work with you in the long run to keep it a family business.
Oh, absolutely. And then I have my youngest son that wants to be a doctor as well. So
Fingers crossed, both of them. Yeah, good for you. I hope that comes true. So tell us where your practices are located.
Well, we have two clinics. The main one is in Tijuana. We decided to open Tijuana strategically. Well, first because I'm from Tijuana and I grew up in TJ. I grew up crossing to San Diego. I live in San Diego. Been living in San Diego for the past 25 years. So Tijuana was natural for me, but it's also Mexico's number one medical destination, medical tourism destination. So I'm privileged that I grew up in Tijuana. So the first thing was open Tijuana. So I looked for not a suitable place. I look for the best place that I can find to offer an experience for the patient. It shouldn't be just medical. Medical is boring sometimes, and it's scary for most people. But when you provide them with an environment that is nurturing and positive and in a great location with great views and awesome care, you take that pressure down, you take that fear away. And so that to me, that was very important. My first location in Tijuana and my second location is in Cancun. And for the same reasons. Strategically speaking, Cancun is number 2 in medical tourism in Mexico. I think Cancun's airport is number 1 in Mexico for international flights, even over Mexico City, which blew my mind because Cancun is big, but not Mexico City big. And you've been to New York and maybe you've been to London or Paris. These are big cities, big old cities. And you would think Mexico City would take most of the flights in Mexico, but no, Cancun is number 1, especially for international flights coming in. So we set up in Cancun in the same fashion. We wanted to look for a place that was, nurturing, nice. I want the experience to feel like you didn't leave the country technology wise, science wise, but you did leave the country, care wise. You're gonna feel cared. You're gonna feel, secure, and you're gonna feel that you're getting the first world medical treatment.
Yeah. So I'm sure they're both, and I've looked at the sites, both beautiful locations, which is fantastic. You talk about medical tourism. I think I want to get into that a little bit, but we're really talking about, let's answer this first. What is regenerative medicine? And then who is it for and who is it not for?
Okay. Regenerative medicine is a broad term, and most people think regenerative medicine is just about stem cells. It's not. There's a lot of products that work in regenerative medicine. It can be stem cells, it can be exosomes, PRP, even peptides, and peptides are getting very big in the U.S. So regenerative medicine is just a clinical practice that helps your patients recover from injury or from disease. And it's just a broad term. In general, what we do, and this is the specialty for my clinics at least, is stem cell therapy. And that's number 1, that's highlight. And then all the other therapies, around it, that is not just regenerative medicine per se, it's integrative, it's functional, it's what medicine should be.
Okay. Love that. So why are there some stem cell, at least you hear about it, I don't want to say that it happens to everybody, but there's some stem cell treatments that will work and others fail. Is there a reason why it may work in some individual and it won't in another?
Well, there's a lot of nuance to it. And my first thought is expectations. And there's so much hype towards stem cells that people think they're these magical IVs that will cure you of whatever you have in one IV session and you're done. Yeah. I'm very sure that clinics and people have made all those claims to bring in more people and stuff. It just made it difficult to pick and it just made it confusing for everyone. So stem cells are not this magical, therapy that's going to come in and build you a new kidney. for example, or a new liver, and a lot of people think that, and the problem is that doctors aren't setting smart, healthy expectations for the patients. If I come to you and lie to you and tell you you're going to grow, your cartilage back from your bone-to-bone situation in your knee, I'm lying to you, and a lot of people do that. Stem cell therapy works on a lot of people, and it doesn't work on a lot of people. It has to do with the patients. We have to check the file. We have to see what the condition is. We have to see how far along is the condition. Lifestyle is very important. You can't do anything if somebody's lifestyle is affecting their health. Let's say we have a patient that comes in with diabetes, and I know I'm jumping around from joints to diabetes and all that, but let's say somebody comes in and says that okay, I have diabetes, I have ED because diabetes, I want to treat my ED, and that's the most important thing. ED, they came for ED, but the big problem is diabetes. That's not the only problem. You also have testosterone problems. You have with diabetes, you have vascular problems. So there's a lot of problems happening here. And they asked me, Doc, am I going to be able to have sex? And I'm like, I don't know. What's the etiology? What's the cause of your ED? Oh, it's diabetes. It's not that simple. With diabetes, it can be many things. It's vascular. It's hormonal. There's a lot of things happening. So what I'm trying to say is that it works on people when you diagnose them, when you do your clinical triage, and when you set the right expectations. It's not magical, but it does gives us a lot of benefits that before we just used to throw them away. I remember when I was in in internship, and I was going through OBGYN. I probably performed like 700 natural births, the whole process. And after you cut the umbilical cord and give the baby to the pediatrician, you're left with the rest of the umbilical cord and the placenta adhered to the uterus. So you have to wait for the mom to expel it, and then you put it in a bio bag and throw it away. So that's what we used to do with these tissues back when I was in medical school. Now these are valuable because we can save lives with them. So these trash tissues, or these tissues that were meant to go to trash, are now one of the most utilized therapies in the world, because we can get stem cells from placenta. We can get it from amniotic fluid. We can get them from two areas of the umbilical cord. That's cord blood and Wharton's jelly. So from birth tissues, this is where we get the highest potency, best quality stem cells that we can use on patients.
Okay. And I know when we had talked about this before, like some people, let's say they've got knee discomfort. They're like, okay, I'm going to have stem cells because I've got some maybe bone on bone, maybe not horrible that you're not going to be able to fix that. But some think, okay, I'm just going to get an injection into my knee. Do you do that same thing, or you add something additional to that, what you do from a care plan of somebody in your clinics?
Well, let's set the scenario. We have a 50-something-year-old guy, active, plays tennis, golf, whatever. And there's arthritis. This guy's been walking for 50 years. There's bound to be inflammation, especially in the knees if he's active and athletic. So he has pain in the knees, and he had an MRI, and the MRI says it's arthritis, osteoarthritis, and maybe there's let's make it a little bit more complex. A partial tear in the ACL.
Okay.
There you are. The guy is sore. He can't walk very well because it hurts, etc. So he comes to us and asks us what we can do for him. So the first thing that we got to see is, why is this happening? So now we know that he's active, etc. So we're talking about a fairly healthy person, and we're not discussing anything except the knees. So in this case, a knee injection is appropriate, but at the same time, we also have to take care of general inflammation. So stem cells work by homing in to cytokines, and cytokines are basically chemical messages, chemical signals that your tissues produce when they're in trouble. You know, if something happens, your tissue throws out cytokines, and these cytokines are a bunch of chemical messengers. Some messengers increase blood flow, some messages produce pain, some messages increase inflammation, and this is all to protect the area and to recruit resources into the area in order for it to be healed. Now, at a certain, and we're born with a ton of stem cells, which we use throughout our lives, and by the time we're 40, we've used most of them and most of the potential. That's when we really start to see people age more rapidly. I don't know if you've noticed that, but at 40 is like when they really start to decline, because our body is not regenerating as fast and as well as it did when we were younger. So taking that as a premise, when we apply stem cell therapy, we're going to assume there's going to be a lot of inflammation in the body. The problem is if I inject just the stem cells in the knee, it may stay in the knee, or it may go elsewhere in the body where they're more needed. And if there's a lot of inflammation, it's just going to go everywhere in the body, and we're not going to get the effect that we want in the knee. So expectations, results. The patient's going to go, hey, it didn't work. I just spent a lot of money and nothing. Okay. But if we take a more general approach, and this is where functional medicine and integrative medicine comes in, and most doctors take this approach, we try to cover everything at the same time. So the first thing we have to address general inflammation. That means that we have to inject IV stem cells. So that's where the dosing protocol comes in. What is the right dose for every situation? And for this example, a large joint such as a knee, such as a shoulder or a hip needs about 10 to 15 million stem cells. More than that, it's overkill. Less than that, you're not providing, the right therapy. So we need about 15 million. And then we have to address general inflammation. Now, fun fact, vials of stem cells are made in 2 cc vials. And the most you can fit in a 2 cc vial is about 25 million. So you jump from 25 million increments, and this is in most labs. So if we pick 2 vials, which is 50 million, we get 15 million for the knee, and the rest of it is delivered IV to address general inflammation. So that addresses general inflammation and allows the ones that we inject in the knee to actually stay in the knee and do its job. At the same time, what we inject in the knee is not just stem cells. The best way to deliver stem cells is by mixing them with PRP. So there's 2 reasons to mix stem cells with PRP, and they're very good reasons. The first one, PRP may be the best medium to inject the stem cells with. It's your own blood, your own plasma, and the stem cells adapt very well to the warmth, to everything. But at the same time, and this is number 2, your own cytokines, your own chemical messengers that are running around your body, they're contained in that plasma. So by presenting the plasma to the stem cells already have an idea of what to do in the body. So when they come in, they can address what they need to at that time. So that's the PRP with the stem cells locally injected in the knee. And IV, it's stem cells, and then we always add, I believe that most clinics add exosomes to the package. And exosomes are basically the products of stem cells. Stem cells produce exosomes. We can do another podcast to explain the absolutely. But most places offer exosomes in their therapies, because about 8 years ago, Dr. Kaplan, Dr. Machado, Dr. Riordan, all the big shots, they met in LA for the American Academy of Anti-Aging, medicine. I'm a member, and I went to all of those symposiums and roundtables and stuff. There's two things that we learned that year, and I think it was 2016 or 17. Dr. Kaplan's is when he backtracked and said, these are not stem cells. Well, yeah, they're not stem cells. If they were embryonic. Mesenchymal stem cells are different, and we can have a whole podcast on that, on why that happened. So instead of calling them MSCs, mesenchymal stem cells, now he calls them medicinal signaling cells, because what they do is that they produce medical signals.
Okay.
The cytokines, they produce the cytokines, and that's how they exert their functions. So they came up with that, and at the same time, they talked about exosomes, and they went like, oh, we should really take a look at exosomes, because we think that exosomes are the real deal. They're the ones that exert the function of the stem cells. To a point, they are. The only difference is that exosomes are products. They're chemical compounds, and they have a lot of uses. But once you use them, they're gone. Versus stem cells, they're alive, and they stay alive in your body. They produce exosomes for a period of time until their cell death. They come to a point that they go through apoptosis, they get absorbed by the host system, and they're gone. It takes about 8 months to a year, depending on how you inject the stem cells. Okay. So a good protocol, an effective protocol, should always take into consideration all of these areas. And that's just on the regenerative portion. So you get the IV stem cells and the exosomes, you get the joint stem cells with PRP. And then what else? There's in my case, I'll prescribe peptides, for example. There's a big stack that everyone uses. They call it the Wolverine stack, and it's the BPC 157 TB500. I'm pretty sure you've either used it or heard about it. Yeah. It does wonders with joint stuff. So that's something that I prescribe my patients sometimes when they're open to it, and when they're in the position to get them easily. We don't want people jumping through hoops just to get the stuff that we're offering them. So we use peptides sometimes, and we always use supplementation. Okay. In these cases, there's a ton of supplements that we can name, but for example, one of the main ones that we all should be taking is vitamin C. And you go like, vitamin C, antioxidant. It's not an antioxidant. It is an antioxidant, but it has so many other functions in your body that are more important than just the antioxidant. And I think that collagen is one of the main ones. If you want to be producing collagen, you need to collagen is C, no? So you need to be taking vitamin C. Depending on patients, I take a look at their clinical history, and I decide what type of supplements are the best that are going to help this patient. And then physical therapy. Yeah, I work with a lot of chiropractors. I work with physical therapists, acupuncturists, and I do this because I don't have the time to do the follow-up. I have too many patients, and my focus is regenerative medicine. It's not physical therapy. It's not chiropractic. It's not. My focus is providing the best stem cell therapy that I can, and delivering this to the clinician so they can follow up and actually make things happen. Because that's where the magic happens. The stem cells just give you, they just give you a better chance at recovery and at taking advantage of all the therapies and all the supplements or all the actions you take to resolve your issue.
Okay. Yeah. Well, thank you for that. Sounds like your clinics take a whole health approach. locally to an issue, but you address what the patient has from an overall health perspective. And I think that's probably the best way to approach it. And that brings me up to, you had mentioned medical tourism earlier. So why are there patients that are traveling from the US, whether it's close to you in San Diego down to Tijuana, or going from Chicago down to Cancun? Why are people traveling outside the US to receive regenerative medicine?
Well, the biggest hurdle is that the way regenerative medicine should be applied is not available in the U.S. That doesn't mean there's no regenerative medicine in the U.S. There is.
Okay.
There is stem cells. I think Florida and Texas are already doing stem cell therapies, but there's a lot of locks to it. It's not just regenerative medicine is open in the U.S. It used to be open a few years ago. There were many labs. One of them was Utah Cord Bank, for example, and doctors in the U.S. could get stem cells from Utah Cord Bank and apply them in their patients, in their clinics. The FDA cracked down on that under Biden's administration. They didn't make it illegal. They just made it more difficult and more expensive. So in order for us to deliver an effective regenerative medicine therapy, we need to look at many things. And one of the most important things is the potential of the cell and the bioavailability of the cell, so where they come from. And there's with stem cells, there's two types of stem cells that we use clinically. The embryonic iPSCs and all that. That's research. They're not used in real clinical setting. So the ones we use are autologous cells that come from either your fat or your bone marrow. So you can get them from tooth pulp or stuff like that. And my problem with that is that these stem cells are stem cells. The problem is that, one, they're already aged, so the potential is gone. If I get a 50-year-old and do a lipo, he's going to look great with the lipo, but the stem cells that I get from the lipo are going to be worthless. Really, they're going to be good for relieving inflammation, at that moment, just like exosomes, but they won't give me that long-lasting effect that stem cells give you. So that's one. And the other thing is that autologous stem cells also have to be in the amount necessary for the condition. So most conditions are about 1 million to 2 million stem cells per pound of weight. I don't know if you knew that. So it's by weight. And most clinical protocols, if you look into the bibliography, they're all given around the same. About 1 to 2 million stem cells per pound of weight. It has to do a lot with type of condition, if it's very inflammatory or not, how long the condition has been going, are there any other underlying conditions. There is a cap, there is a bottom. If I have someone that needs, 300 million stem cells for their condition, well, sometimes that's not viable or feasible economic speaking. So we bring it down to a base treatment. And sometimes the patient doesn't have the right weight for the therapy. So we bring it up to that. So for example, a kid with autism, needs about 1 to 2 million stem cells per pound of weight. But let's say that the patient's less than 45 pounds, or it's 45. It's the youngest you treat about 4 years and 45 pounds of weight. But the base treatment is about 100 million. So the lowest we go is 100 million as a protocol on autism. And if the patient is heavier, then we go for that, okay, 1 million pound of weight, depending on the patient. Take a sip of.
Yeah, no, that's good. So if I can ask from a business perspective, from the medical tourism, when people are coming in, like, do you see that there has been an increase in business for you because now stem cells and regenerative medicine is being, brought to more awareness of people? Are you noticing that your business is busier?
Oh, okay. Yeah. So going back. So in Mexico and other countries, stem cells are allowed to be expanded in the lab. So it's a process where you replicate them to get the right amount of stem cells for therapy. The detail to that is that you have to expand them to get enough for therapy, but if you over expand them, you're basically aging them, and you're back to square one, and they don't work. So that's why a lot of therapies in Mexico and abroad, people come in, they get the therapy, and they don't get the results. One reason is this person, their expectations were too high. Another reason is the lab expanded the stem, wanted to make more money, so they expanded the stem cells that they have even more, so they could have more vials to sell, so that they're. Or three, this patient didn't react to stem cells. There are people that don't react to stem cells, and it's normal. Every clinical activity that we do has its success rate, and then the rate of people that don't get anything from it. So those are the three main things. So in Mexico and other countries, not the US or Canada, for example, you're able to expand them, so that way you get the right amount of stem cells, and you're able to apply them in ways that in the US wouldn't be feasible. Like, for example, for low back pain and epidural injection, or for neurologic conditions when you have a spinal cord injury or Parkinson's or Alzheimer's, where you want the stem cells to be in contact with the central nervous system. We inject them intrathecally, so in the cerebral spinal fluid. That can't be done in the US. Okay. I haven't dug into the regulations or anything, but it makes no sense. And even speaking with American doctors and colleagues that send patients to me, it just doesn't make sense, because they're safe, and that's why. And because they're deemed safe, that's why we can apply them in the U.S., in Mexico, and everywhere. And in the U.S., you can't do that. So in order for you to get these types of therapies, you have to travel abroad. Now, Mexico is next to the U.S.
Sure.
So in our case, Tijuana has been instrumental because we're so close to San Diego. Everyone can fly to San Diego. Everyone wants to go to San Diego. So they go to San Diego. It's a national flight. It's a local flight. You don't have to get out of the country. You go to San Diego, and I have a van that picks up our patients at the airport, or if they stay at a hotel in San Diego, whatever. They pick them and they bring them down to the clinic. If they stay in Tijuana, we keep them at the Grand Hotel that's right there where the clinic is, and then we bring them back to San Diego. So it's a national flight. You don't have to leave the U.S. basically. You're there in San Diego, and we'll bring you back across. And in the case of Cancun, it's an hour flight from Florida. So that it's a great location for people back east, Midwest, and the eastern Canada. That's where all of our patients come from. For Cancun, it's kind of split between the Rockies, split up. The Rockies to the east, to the west of the Rockies, we get them in TJ. To the east of the Rockies, we get them in Cancun, and mostly we'll get some people, cross back and forth. I have a patient that's coming in on January, and he's been to Cancun twice, and now he's coming to TJ.
Okay.
Well, he's coming from Canada, and he doesn't want to fly to Cancun. You want to fly, make it closer. So we've seen a lot of growth in the past years, but we've also seen a lot of growth in the industry. So there's a lot of clinics popping up, and everyone's doing stem cells. And the problem that I see there is that these are people that are coming in, for the fad. That's a therapy that's making money. Let's go there. It's easy. So and that's where we start to get the problems, where we get people that overpromise, and that I think that's one of the main issues that drives the industry to lower standards, because when you overpromise and underdeliver, that's when you start getting problems. And I'm a Tony Robbins student. I've been a Tony Robbins student for 8 years now, maybe. And one of the things that Tony says, and this is, and you hear him, if you ever seen Tony, you always going to hear this. Your clients, patients, have to be your fans. They have to become your fans. So you always have to under promise and over deliver more value than anyone. And you can't do that when you're just trying to make it, and you're working on lowering the prices just to get the patient in, and all of that just creates a negative vacuum where the therapies that you're offering are not effective because you're over promising. And for example, if you're a doctor that are looking for the cheapest option, you go for a lab that is expanding the cells more than they should, and then you're delivering therapies that are not effective. So, and that's the reality. And that's why so many people are afraid and suspicious of coming into, for example, Mexico and getting stem cell therapy. It's not just Mexico. It's Colombia, Panama, Costa Rica. They're all over the place. And most doctors in the U.S. that were doing stem cells before 2020, most big doctors moved out of the U.S. Dr. Machado with Regenix moved to the Caribbean. Neil Riordan in Panama. Then can't remember this guy's name. He opened up BioAccelerator in Medellin, Colombia. So most of the big guys in the U.S. just moved abroad because they couldn't practice in the U.S. So
yeah, when you have the need, they'll find you. So people are searching out for you.
Absolutely. Pain. Pain is a big driver, big motivator. If you're in pain, you'll do anything to get out of pain. And we try to do the most that we can for our patients to relieve them from that pain.
Yeah. Dr. Ramon, I'd love for you to share a success story of a patient that's come in to see you and what you've been able to do for them and like changing their life in a positive way.
Well, I'm going to share two. And these are these are two of the first patients that I treated. When I first trained stem cells, I was treating people in Mexico City. My patients were from Mexico City. And I used to travel to Mexico City and treat them. They were all high net worth individuals. Because I didn't know where to place the therapy. So I just went with my friends. And these are all big shot entrepreneurs and business people. You maybe heard some of the names, but remember one of them. He used to own that. This person already passed away. He was older. He owned the Formula One racetrack in Mexico City, and he loved to ride his bike. So he was riding his bike in the track. He was 74, 75. He was riding his bike, had an accident and fractured his scapula. He'd been dealing with pain for about 3 months into it. And his son, my friend, called me and said, "What can you do for my dad?" Because he saw what I was posting about stem cells, etc. So I said, "Well, we can try stem cells and see how it goes." And he was one of my first patients. I didn't know what to expect. I only knew what I read or what I've seen at the lab and stuff. So I flew to Mexico City. Then they brought me down to Puebla. That's where they lived. I hired a military nurse. And I had all my kit with me, my crash kit and everything, because I didn't know what to expect.
Sure.
And as an allergic reaction or anything, I can deal with it right there, because this was at their house. Big no-no, but so we did the therapy and everything went well. I think we did like 2-3 therapies. No, two therapies. And about 3-4 months after, I got a call from my friend saying that his dad's orthopedic surgeon wanted to talk to me. So I talked to the guy, and when I called him, he said, "Well, what the F did you do to my patient?" And I went like, "What?" "Yeah, he had a fracture. It was a small fracture. It was painful, but we were treating it, and we got an X-ray, and we can't find it." And I was like, "Whoa!"
Oh.
Even I was. It was a small, hairline fracture or anything, but they couldn't find it after 4 months. So that meant that he had this miraculous recovery. You don't get that a lot, but you get them sometimes. And those are the ones that you picture and boast about them all over the place. You have them, many of them, but it's not the common result. And then his son, my friend, was asking me, "Hey, what the hell did you give my dad? We haven't seen him in like 2 weeks. He has so much energy. He's back with his mistress." All of that, like, here's this 75-year-old guy that just had stem cells and is feeling better, is going out. If he's going out and out and about, it's because his back is not hurting and his knees are not hurting. It wasn't just the scapula that killed, but he felt better, and that's why he was out and about. So that was like big light bulb,
Sure.
turning on. Flash forward a couple of months, half a year maybe, in my clinic in Tijuana, the first clinic that we had, I had this patient, a Canadian patient, come in with arthritis, rheumatoid arthritis. I wish I could find his pictures. I'm going to try and find them and send them to you. His claim was that he wasn't able to make a fist for 8 years. His hands were deformed. There was a lot of deformity. They were red, and he said, I haven't been able to make a fist in 8 years, and he was a lumberjack. Imagine someone that can't use his hands and he relies on his hands to work.
Yeah,
I don't know if they do it with an axe anymore, but he worked at a lumberyard.
sure.
So yeah, we provided the IV therapy, but with autoimmune is IV. You don't go into the joint because there's no need. It's every joint that's affected. So unless there's a specific need for us to go into the joint, so we delivered an IV therapy with stem cells. We didn't use exosomes back then, and probably a month and a half after that, I got a message on my phone, and it was 4 pictures. It was 1 picture, 2nd picture, 3rd picture, 4th picture. He was showing his hands. They weren't red anymore. He was making fists, and he was opening up the hands, and I went like, wow.
Yeah.
So those 2 cases were enough for me to say, I don't like aesthetic medicine as much as I'm liking this. And back then I was doing Botox fillers, and I was going to LA, and I had big red carpets, and getting interviewed, and we did well. I mean, with aesthetics, but it wasn't as fulfilling as this is. On a personal note, I've used it in my family. My wife works for a big company, and she's been working there for a long time. And when I met her, she had a carpal tunnel syndrome, really bad. First IV therapy, gone. And it's been gone ever since. So it's been probably for her about 10 years at least that she hasn't, struggled with carpal tunnel syndrome. My younger brother, had kidney deficiency. He was kidney failure, and I donated my kidney to him when I was about 23, maybe. Well, he lasted about 20 years without any problems, and he went into kidney failure again. And we kept him. Well, it was 15 years, and we kept him alive for 10 more years with stem cell therapy.
Oh my!
Of course, he had his dialysis and everything. But if you would see all the patients that were going to dialysis and compare them to my brother, you would see someone that, clinically speaking, is in excellent condition. You would see the same cohort that came in to dialysis when he came in. People would die off and die off and die off. My brother was still there. At the end, it was heart failure, and we couldn't do anything about it. But with stem cell therapy, we were able to keep him in with the best, quality of life that we could for the time that he was here, after that. So
yeah, that's amazing. I mean, it is about lifespan and how healthy you are all the way through. So you definitely had some concerns, but to expand that for 10 more years is amazing.
well,
And congratulations on that.
well, that comes with the concept of health span. I think that concept is better. People think about lifespan, but why do you want to live? You can't even move, or you're bedridden, or no. You want to be wild and crazy and run and do everything you want until the day that you die.
Yeah.
You want to be healthy. You want to have that health span. So
Yeah.
stem cells are a very good way to doing that, because I consider, and this is me, I consider stem cells the single best therapy that you can deliver, to your body to improve your health, for the long run. As an anti-aging therapy, I've been taking them for the past, but it took me a while for me to put them on, because I thought they were too expensive. So I started getting stem cells on myself about 6, 8 years ago.
Mhm.
And the only thing that I can say is that I'm 50, 250 pounds, 6'2" almost, played football, martial arts, surfed. I'm pretty beat up, and nothing hurts. I mean, nothing, not my back
Fantastic.
or my neck or my knees or the other day I was walking my dog. It was raining, and I slipped and fell on my shoulder. I'm a pretty big guy, so
Okay.
I tend not to get hurt easily. But
Sure.
I just went cold, boom! It hit my shoulder, and I thought, oh, I'm gonna have a problem. And I did have what was that? I think it was the bicep muscle, or one of the rotary cuff muscles, got really sore. I kind of did some massage on that. I took some ibuprofen, and 2 days after, nothing. And
Oh.
I can really say that stem cell therapy has helped me a lot. I sleep better. I think quicker. My skin. I have rosacea, but I don't think I have the skin of a 50-year-old. You know,
Yeah.
I haven't gone for the hair thing, because remember I told you I'm afraid of needles.
Yeah. Yeah.
Yeah.
Understood. Well, you look very healthy. I'm glad you are. Glad you had the quick recovery. So I want to, as we go to wrap up here, Dr. De La Puerta, and thank you very much for sharing all the information. I'll share all your links that you provide with, so people can find you in the descriptions below, in the videos and the audios that are there. But how would you like people to reach out to you? How would you like them to connect with you?
Well, we have a series of resources people can find us in. We have our website, www.zlounge.com.mx. It's in Mexico. I have a blog. I try to upload the articles that I'm writing into it. I'm not very good at it, but I have a blog that's drramon.com.
Okay.
I write articles on a weekly basis, probably 3 or 4 per month. Let's say 3 or 4 per month. I publish them in Medium and Substack, mostly Medium. It's all about stem cells. I've been working on well, most of the questions you ask me are the answers are there. Why people should go to Mexico? Why are they a good investment? What do they do with for example, with joint issues or autoimmune issues? And I'm going to start working with supplements that you can take, or nutrition that you can improve on the therapy. So I'm going to be working on that. So we have that at Medium. YouTube channel with testimonials. I have probably 3 dozen testimonials there. Trustpilot, etc. I'll forward you the links, so you can offer them as well.
Okay. Thank you for that, Dr. Ramon. So last question I have, you are a guest here on the Prime Health podcast. I do appreciate it. What would you say is your personal definition of Prime Health?
Prime Health should be being at your best, feeling at your best. I think it touches on what we said earlier on health span. When you're in your prime, you feel well, you look well, everything just it's easier when you, because health is not just being physically well, it's all around. It's physically, emotionally, socially, work environment, and everything. So when you're in your prime, that for me, that's what health is, and the building block of all of that is your physical health.
Yeah. Well, thank you for that. And Dr. La Puerta, I truly appreciate the time. It's a very interesting story from when you started into medicine at such a young age, which Mexico allows you to do that. The stories that you have, that you shared of the success of your patients. And I appreciate you sharing us why that there is that ability for people from the States or from Canada or from wherever to go visit in Mexico and Tijuana and into Cancun, where your locations are, for them to get the best of care that's out there that you offer. So I appreciate you sharing that with us along with that story. And I always tell people, as you're listening to this or watching the podcast, if there's one piece of information that you have a friend, a family member, somebody you play pickleball with, or you're just out grabbing a coffee or a donut with, go easy on the donuts, but that you're doing that with, if you feel that they can benefit from this, please do share the podcast, because we need this to touch one person at a time. People need to understand there's amazing practitioners and clinics that are out there. So I do appreciate you sharing that with us. Selfishly, I always do say subscribe to our podcast. We'd love to have more subscribers that are on it. But until next time, remember that true wellness is a journey we are all on together. So whether you're taking charge of your own health or helping others and guiding them in their health, every step forward matters. So stay committed to your Prime Health journey, as I always say. And again, Dr. De La Puerta, thank you so very much for being a guest on the Prime Health Podcast.
Thank you for inviting me.